Hi, everyone. I'm Emily Burrows, our marketing coordinator here at Kids and Company. Thank you so much for joining us at our Kidco Talk today. I wanted to welcome our speaker, Emily Silver, a family nurse practitioner, IBCLC, and co-founder of NAPS. Hello, and welcome back to Kidco Talks. Today, we're going to learn how to recognize signs of parental anxiety and overwhelm, explore ways to seek help and support, and understand the different levels of care available. Emily will also touch on the importance of sleep, peer support, and how to access resources in times of need. This session is perfect for expecting and new parents as well as those supporting them. Webinar participants, we do have the chat function open today at the bottom with the Q&A bubble. So if you have any questions throughout the webinar, please leave them there and we will leave some time at the end to answer your questions. So Emily, over to you.
Hi, everyone. I'm so happy to be here. If you're local to Boston, I'm in Boston now, then it's a perfect day for this. It's cold and rainy, and there's, nowhere else to be right now other than cozy inside listening to this. I would love to know in the chat or the Q&A function, whatever's easier to access, just tell me what brings you here today. Are you expecting a baby? Do you have a baby? Are you around kids? Are you a childcare provider? Where are you at in your life in the parenting space? I feel like that's always helpful to know as I'm teaching in real time. May cater things a little bit on the fly as we go based on who's out there listening and engaging. This workshop is one that we created at NAPS. We call it Managing Parental Overwhelm. And we go through sort of perinatal mood disorders, all the way into just the basic overwhelm and anxieties that we all experience in this space. So my name is Emily Silver. My background is I'm the co-founder of NAPS. I'm a family nurse practitioner and an IBCLC. So really what I do, I was a former labor and delivery nurse for a very long time. I worked in an office and an OBGYN office, but my experience in this topic really it hits home and comes from my time at NAPS, where I care for families when they're expecting a baby into those postpartum, those early weeks home, and all the way really through the baby and toddler years. And I feel that I am at the front of this and really in it with our patients because I'm this extra person that gets to be in their life outside of their OB and their pediatrician, whether I'm supporting with feeding, sleep, transitioning back to work, tough transitions with your baby or your child. All of these topics sort of like intertwine, and we can feel that stress and overwhelm just at a basic level. I always remind people, while I am a medical provider, I'm not your medical provider. And so we're going to talk about topics today that are very important. And if you find yourself hearing this and resonating and knowing that you need support or you need help, we have lots of resources. And we're going to share them today, but I'm also happy to be a contact for you should you need to email me directly to get some kind of referral or more information. Really quick about NAPS before I dive in. I know I just told you a little bit about myself. NAPS, what I want you to know about NAPS outside of that, we provide support in this pregnancy and early parenting journey through early childhood. Most importantly, what I want you to know is everyone on our team is a registered nurse or a nurse practitioner. So really, we pride ourselves on always offering honest, evidence-based information and education. And we always want that support and education to feel not biased and no judgment. And so I think it's important to know we're not only just medical professionals, but I'm a mom. I have 3 kids. I have 3 girls. They are 9, 7, and 3. And so we always want to meet you in the middle of that medical advice, but also the real life parenting advice. And it's always our job to help you find your way. I find myself helping patients and parents just navigating their options and knowing that there's a lot of ways to parent and they're not all wrong. They can be very different. And so, like, how do we find options that are good for your family and talk through risk benefit, pros and cons to make decisions that feel good for you? So, today I want to talk to you just about like worry. The number one question that parents will say to us is, well, what's normal? Like, well, what's a normal amount of worry? Like, sure, we all feel worried. We all feel stressed. We all feel anxious. And what can I deem as normal? And when should I be worried about myself? And like, when should I seek help? What are risk factors? Because part of the perinatal mood space is just educating and empowering parents to understand what puts you at risk and then knowing the signs of when to call for help. knowing that like we don't actually see our providers a lot when we're postpartum. You see your OB perhaps one time after delivery. You do see your pediatrician a lot right out of the gates with a newborn, but then all of a sudden those visits become just those well visits. And so we want parents to understand, especially risk factors, what you're looking for yourself too. And then just like tips to help you feel better right now, tips to help others who are struggling, and then some resources, emergency and just professional resources, all the way into like, how do I find a therapist? Because that's certainly not easy in the medical healthcare system that we exist in right now. Okay. I asked you to tell me in the chat, and I'm going to open it up now, just like a little bit more about you and sort of what I'm going to go over to the Q&A. What brought you here today and why you're tuning in, ages and stages. And now what I would love for you to do is to just break the ice for me and let other parents out there know that they're not alone. So we all have worries. I want you to just say one thing that has made you feel worried or been on your mind, whether you're pregnant or as a new parent. Common examples that people will dive in. So I'll go first are, I'm not pregnant, but when I was pregnant, is the baby okay? How do I know the baby's okay in there? Have they felt the move today? What if they didn't move? How do I know that they're okay? My newborn is sleeping. This is what I did with my first. I had postpartum anxiety. She would be sleeping in the bassinet next to me, and all of a sudden I would say, is she breathing? Touch her chest. I'm watching it rise, right? Is she okay? What if she stopped breathing? What would I do, right? I see, okay, I'm looking in the chat. We have a 9-year-old, a 3.5, a 2-year-old, a 6-year-old, an 18-month-old, 4 and 4, okay. A lot of different ages out there, some babies, people who are around kids. Oh, and great question out there. This is for parents. I'm a mom, so I'm talking about being a mom, but this is for parents, moms, dads, partners, and caregivers. Okay, caregivers, I think if you're around kids or taking care of kids, all right, great. So someone just wrote worrying for my child's safety constantly. 100%. We're always like just wanting to keep our kiddos safe here and take care of them. Let's see what else people are saying in here. Worried constantly about the baby, keeping kids alive, worrying about sleep. All right, you can keep those coming for me. I just want to put it out there that we all have worries as parents. This is very normal, and caregivers too. So what are common feelings that we experience in the parenting space? I want to call out two things. The first is your feelings are just feelings. It's really easy, especially in the parenting space and when we're tired and when we're overwhelmed, to label our feelings as a good feeling and a bad feeling, right? When I was pregnant, I hated being pregnant. I had hyperemesis. I was so sick. And a feeling that I had was, I hate this. I don't like this. I don't want this. But then I'd be like, oh no, stop, Emily. I shouldn't feel that way. Those are bad feelings. You wanted to be pregnant. You should be blessed. You should be grateful. There's people who can't get pregnant, right? And so my feelings aren't good or bad. They're just feelings. And you can have multiple conflicting feelings at the same time, right? You can be home with a newborn and on a Saturday morning when they wake up crying, think to yourself, oh, I just miss when I could sleep in and not have to get up and take care of a person. I just miss when I could hop in the car and drive to Target and not have to take the baby with me. But then all of a sudden you're like, oh, I shouldn't feel that way. Like I wanted this. I should love my baby. I'm so grateful, right? You can have conflicting feelings. You can feel really overjoyed and overwhelmed. You can be excited for this new chapter in your life. We're all worried about our kids getting sick. I saw somebody write in the Q&A that you're worried about sickness and keeping them safe. So we're worried like we need to keep them safe. We're worried about them getting sick. Sometimes we feel like we made a huge mistake, right? Maybe that's in pregnancy. Maybe that's just the way we spoke to our toddler that morning. Like, ugh, I yelled at them when we were getting out the door. I feel like I made a huge mistake in that moment. We're constantly wondering if something's wrong with our kids. Maybe it's because they're not sleeping enough. Maybe they're sleeping too much. Is that normal? A lot of parents tell me they're feeling scared about letting other people watch their kids, letting those helpers in, family, friends, grandparents, caregivers. When we're pregnant, we're afraid of labor. We're worried. Like, what's it going to feel like? What are contractions going to feel like? I already said the baby, are they moving? Are they okay in there? We worry a lot about eating, Are they eating enough? Are they eating too much? So these are common feelings and worries that we all share in. So what's a normal amount of worry? All right. I'm going to try to make it like I try to, whenever I'm talking or teaching about anything, I want to make it as simple as possible and as black and white as possible because it's really easy to, like, I don't know. Normal worry often is temporary and it's not interfering with your daily life. Excessive worry is something that's becoming chronic. It's a lot, it's happening a lot, it's debilitating. It's starting to impact your ability to function, or maybe your just ability to like do basic things like get in a car and drive somewhere with your baby. So let me give you an example. This is a great example for our older kids, right? And so I'll give another one for the pregnant and newborn people out there, but I see out there that there are a lot of older kids. The kids aren't here, right? But the parents and caregivers, you have older kids. And so I think this is a good one for you. Your child wants to ride their bike to their friend's house. The friend lives a few blocks away. All right. So I think like my oldest is about to turn 10 this summer. I feel like this is something that she may ask to do this summer. And immediately I'm worried. I'm worried, right? I'm worried about her riding her bike. I'm thinking about it. The friend's house is a few blocks away. What if something happens? Is she going to be able to cross the street? I need to make sure she has her helmet on. Feeling worried about it. And then I'm thinking, okay, I want her to be able to do this. And I know that she's old enough, and let's think about how we can do this safely. So I talked to her about staying safe, wearing her helmet, okay? Letting me know when she gets to the friend's house. And I'm behind the scenes texting my mom friend, hey, she's on her way. Let me know when she gets there, right? What can I do to make it a safe situation and space? Excessive worry would be that I'm so scared that your child, that she's going to get hurt or that she's going to get into an accident. I've talked to her about the bike riding thing, but I'm up all night thinking about it. And I'm so worried that I don't sleep. And I'm so worried that the next day in the morning, I actually don't let her go, even though I'm hindering her independence. Let me give you another example for those of you who are out there who are pregnant or have a newborn, okay? And I referenced this already about the breathing because I feel like that was a really big one for me when my girls were little. Normal worry is that we all worry about our babies. We swaddle them, we put them in their bassinet, and we think, I hope, are they safe? I'm worried about them. I want to make sure they have safe sleep. I want to make sure that they're breathing. And at the end of the day, we swaddle them, we put them on their back, we put them in their bassinet, we check on them, and we fall asleep. Excessive worry would be like me when I was postpartum, and I told you this, that I'm so worried about my baby's breathing that I'm constantly waking up and I'm touching her chest to feel if it's rising. I'm checking on her, or I'm laying there at night and I'm watching her because I'm so worried that now I'm not sleeping. That's becoming chronic and debilitating. That's impacting my ability to function, right? So impacting the ability here in the child example was I'm actually hindering my child's independence and I am impacting them, versus the newborn example is I'm actually like impacting myself. I'm up all night and I'm fueling my anxiety. Now I'm not sleeping. I'm making my symptoms worse and it's impacting my ability to just be a good mom and take care of my kid. So that's our normal worry versus excessive. Let's just talk about perinatal mood disorders and mental health because we don't talk about them enough. We don't talk about them enough, and we should be, because the perinatal period actually is defined as the period of time through conception all the way through the first year after birth. That's a long time. And perinatal mood disorders don't just impact women. They also impact men, your partners. We know, statistically speaking, that 1 in 4 women will experience a postpartum mood disorder and 1 in 10 partners will experience a postpartum mood disorder. So I saw a dad write in the chat, should I be here? Is this just for dads, or is it for dads? Is it for women? It's for parents, right? And if you're not a parent, it's for those in your life who are becoming a parent or a parent. We need to be all checking on each other and taking care of each other and looking after each other, because mood disorders are also a lot of things. In our culture and our society, we talk about mood disorders often as postpartum depression. And sometimes in the media, they call it the postpartum. She had the postpartum, he had the postpartum, right? And they usually mean postpartum depression. And yes, you could be depressed. You may not be depressed. You could just be anxious. Some patients that I work with don't even know they're anxious because they're not actually having worries. or fears, they're having physical symptoms. Their anxiety is presenting as feeling a little dizzy, feeling like they can't take good breaths, maybe a little tight in their chest. They're physical symptoms. They're not having what they think they should be having, like emotional worries or thoughts. Maybe they're having both. You can have depression and anxiety. Some parents that I work with are having symptoms of OCD. That's obsessive compulsive disorder. You could just be having obsessions, like those are the obsessive worries, and now they're becoming chronic and debilitating. Compulsions are when you're actually doing things to try to stop the obsessive thoughts or the worries. Intrusive thoughts, we all have them as parents. As people, we have intrusive thoughts. Those happen, right? And so those can be very common, those thoughts that are creeping in all the time. What if I drop the baby? What if I fall down the stairs when I'm holding the baby? What if I drive with the baby today and I get in a car accident? We all have intrusive thoughts, right? They can be very heightened when you're postpartum and when you're not sleeping and with the hormones. Too much worry, again, you're avoiding doing those. You're not holding the baby. You're not going down the stairs. You're not driving with the baby because those worries are bothering you so much. And that's when we're going to reach out for help. PTSD, post-traumatic stress disorder. We work with a lot of parents who are struggling postpartum because they had a traumatic delivery, something that happened during their labor. More rarely, bipolar disorder, and very, very rarely, but I know you hear about it often, postpartum psychosis. You hear about this. It's very, very rare, but we hear about it more because it's scary and it's rare. And those are often the stories that get picked up more so in the media than all of these other things that people are more commonly experiencing. So I want you to know your risk factors. What are your risk factors for perinatal mood disorders, for worries, for anxieties, for depression? Many health conditions have their risk factors, right? Like your heart disease, type 2 diabetes. Like we can tie things back to what are my risk factors that are going to connect to this health disorder. And so like medical conditions and health conditions, perinatal mood disorders have risk factors. We teach these in our prenatal classes. So when parents are expecting a baby, we teach these because while you're seeing your provider, your OB or your midwife in pregnancy, we're not screening often or as we should be. And when you're postpartum, like I already mentioned, you have one checkup with your OB or your midwife. Pediatricians are usually really good about screening for this. When you go to your pediatrician, when I go to my pediatrician, they hand me an iPad every time I come in, and I'm filling in the postpartum depression scale to see if I'm high risk. So like my point is we should be screening more, and I wish we were screening more, but we're not. And so I want you to know your risk factors. And the biggest one is family history. So can you talk to your parents? Can you talk to your sister? Can you talk to your relatives, your brother, and say to them, especially if they're parents, what was your experience when you were expecting a baby? How was your experience postpartum? Do you have any risk factors or history of these mood disorders that I should know about? Because that's really important, especially, we know, especially for depression and anxiety. Other risk factors, which are very, very real and different from like, if I don't eat healthy and run every day, I'm at risk for heart disease. Risk factors for peri mood disorders, inadequate support. I mean, hello. How many parents out there don't have enough support? That's a really big one. Not having enough help from friends and family in caring for your new family. And the village looks very different now, which can feel scary, right? The village, I feel like, for my grandmother was she lived in a neighborhood and she didn't work and she had 6 kids and the kids took care of the kids and all the other women were home in the neighborhood and there was like a village, right? And the family came, her mom came to help and there was this village, right? The village looks different. Not all of the parents I work with even have family in the same state as them. They may say to me, my family lives across the country. I'm here in Boston and I'm with my partner and we don't really have family around. So then I'm like, okay, what is your village? And it might be friends. It could be neighbors. It might be outsourcing and paying for help. It might be outsourcing childcare or a nanny, and they're building their village. Financial stress is very real. Families often feel anxious or worried about money, debt, growing expenses with your growing family. Marital stress, partnership stress, right? We can have anxiety that then causes us to argue or feel defensive or withdrawing and a conflict in our marriage or partnership, which is going to play into this. Parenting stress. Parenting stress is really real, very real. Preconception, like going through fertility treatments, IVF, trying to get pregnant, being pregnant. I mentioned PTSD after birth, like going through labor and delivery and maybe having a traumatic experience. There's feeding stress. I said this at the beginning. We're worried that we're not feeding our baby enough or we're overfeeding them. With our toddlers, they're not eating enough. They're picky eaters. Like there's constant stress in the parenting space. That can play into this. And then a major life event, loss of a family member or a friend, moving to a new home, losing your job. These are all really important risk factors for you to know about and understand that can impact. All right, let's talk about tips to like just help you or someone else feel better right now. Like really easy stuff, you all. Really, really easy stuff that you can think about and do that will help you feel better. First, let's talk about self-care. Taking care of yourself, taking care of your partner, your family. All right. Self-care, despite what you may see on Instagram and TikTok, it's not a bath bomb. It's not a glass of wine. Like it's actually just like protecting yourself, putting some boundaries in place to take care of yourself and your family to meet your basic human needs, right? And how do we do that? I use the word naps, right? I might NAPS, naps. N is for nourishment. How are parents feeding themselves, especially when you're postpartum? Where are your meals coming from? Who's grocery shopping, right? These are the things that we can lean into our people for help on. The village. Maybe it's the friends, maybe it's the family, maybe it's outsourcing, all right? And so we need, especially if I have parents who are struggling on top of being postpartum with a mood disorder, the greatest gift that you can give those people is food. Food showing up at their door. One less thing to think about so they can nourish themselves and take care of themselves. So that could be a meal train. That could be the person that keeps asking you, I'd love to do something. What do you need? Can I help? Yes. I will like dinner. Great. I'd love to drop off dinner. If you're taking care of someone else, don't ask if you can drop off dinner. Just tell them, I'm going to drop off dinner this week. Does Tuesday or Thursday work better for you? Because when you're depressed or when you're anxious and you're overwhelmed, it's really hard to accept help. It's really hard to say yes. Like you just easily, it's okay, we're fine, right? Naps works with Feast and Fettle. They're a local meal delivery company. You can outsource this. You can have your meals delivered, which by the way, if you're in New England and you want a code to try their food out, I'll drop it in the chat at the end. But like, how are you feeding yourself? Next for my parents is alone time. It's easy to feel overwhelmed. It's easy to feel like you don't have enough help. And when you're very busy taking care of a newborn, it's hard to find a minute for yourself. And basic human needs like is not alone time. Basic human needs to me are like showering, shitting, pumping, eating. Okay, like that doesn't count. Sometimes when I work with a mom, they're like, did you get a minute today? Did you take a break? Did you take a breather? Like, oh yeah, I pumped for 20 minutes and I sat alone when I did that. Or a dad will tell me, yeah, I grabbed a quick shower this morning, before the day started, right? Those are your basic human needs, which I would like you to have, but parents deserve a minute, I call it like stepping away from the scene here, like minutes, 20 minutes, all the way up to an hour. So in our prenatal classes, and if you're pregnant or expecting a baby, or if you have a newborn, maybe you have a toddler at home, I have parents sit and I'm like, let's make a list of the things that you like to do that make you feel good, that make you feel like you. And they need to be your little things up to your big things. So I hear parents and that like you might not be able to take an hour every day for yourself, right? Maybe you need to have those quick ideas when your partner says to you, hey, get out of here. Step away from the scene, take 20. And you're like, oh, I don't know what to do, right? Can you do a face mask? Can you go shut your bedroom door and listen to music? Can you listen to a podcast? Can you leave and just walk around the block a few times? Maybe you walk the dog. All the way down to like, what do you like to do? Do you like to go to a yoga class? Do you like to get your nails done? Do you like to play golf? Like, what are things that you like to do? Because you and your partner need to protect each other. All right. And so what I have parents do is like generate this list and then they're in charge of taking care of each other. Family or friends can encourage this too. And so let me give you an example of a husband and a wife that I worked with last month. We talked about this in a prenatal class and the baby came a few weeks later and I was like, let's like set up what it is that you like to do. The wife had said to the partner, for me, what I need to feel good for the day and to like tackle the postpartum day is just a long hot shower in the morning. So a long hot shower, then I can get dressed, I can do my day. The husband in this couple example said, like, I need to run. Like, I need to start my day with a run to like feel functional, to feel good. So they just build it into their day. And every morning he got up and he went for a run. And when he would get home, he would like, whatever, maybe eat, maybe he showered, I don't know. But then he would take the baby and say, it's your turn, go up and take the shower. Now, maybe he ran for 45 minutes, maybe she showered for 20. It doesn't have to be even Steven, but like you have to protect each other and you have to give each other some alone time because that's going to help. It's going to help your mental health, your basic human needs being met. People, who are your people? So I started talking about your village. I talked about outsourcing. I talked about saying yes to the lasagna. But like, who are the people in your life that can help you? Again, we have parents do this when they're pregnant, with newborns, with toddlers, your young families. You have to revisit this list often. But who are the people that you can ask for help from? Who are the people that can come into your home and help you and you don't feel overwhelmed? All right. And I have parents make a list. So my list of people are providers and friends and family. These are also not only the people that you're asking for help from like, can you hold the baby? Can you run the laundry? Can you bring the dinner? They're people that you're asking for help from for parenting thoughts and opinions and decisions. We've all received unsolicited advice from the person at Starbucks or from, like the person who saw your pregnant bump and they were like, oh, they make a comment, right? And so, like, the people are people that you're leaning into for support and advice. And when you're trying to make parenting decisions, my list is my pediatrician. I love my pediatrician, and I firmly believe that parents should love their pediatrician. If you don't like your pediatrician or you don't vibe with them, you should change pediatricians. You should have a good pediatrician. I hope that naps can be on your list if you need feeding and sleep support, like a naps nurse or an IBCLC, a lactation consultant. My best friend Jamie, who's my business partner, is on my list. That's an easy one. We own the company together and we're best friends, and I value her opinion. My mom and my sister, my biggest helpers in my life, like literally helping me with my kids and when I need like sound advice on making parenting decisions. I always tell parents, grab another couple in your life that are already parents that you like their style. You're like, ugh, I love the way they talk to their kids. I love the way they parent. I love their parenting style. Like you admire them. That's a great couple to have on your list. So these are people that you're turning to, not just for advice, but people that you can like freely let in to help you. Whether, again, it's holding the baby so you can shower. And then asking for help and accepting help is a learned skill. It's really hard to do. There are some real terms out there that are backed by research, like being a martyr, gatekeeping as a parent, like not letting anyone help you. These are real things that we do, especially postpartum when we're not feeling good and our hormones are really wild and we are feeling anxious. It's really easy to just say, no, I'm fine. It's hard to ask for help. And often we're being offered help and we don't even accept it. So asking for help is a skill and you need to practice it. So I tell parents every day when you get up and when you're postpartum, in that first year especially, and you should still do this. I have older kids and I still try to do this. What's one thing that you're going to do that day? What's one thing that you're not going to do that day? And what's one thing that you can ask for help on? So just get it into your brain. So I wake up in the morning and I'm postpartum and I think to myself, the one thing I'm going to do today, come hell or high water, is I'm going to get outside. I'm going to go for a walk with the baby. The one thing I'm not going to do is fold the laundry in the dryer. I hate doing laundry anyway. There's like pounds of it sitting in my upstairs right now. But I say I'm not doing that today. And I'm going to ask for help. I'm going to ask my husband to pick up dinner on his way home from work. All right? Easy, done. At the end of the day, when the day is long and then all of a sudden it's over, I'll say to him, what did I do all day? I went for a walk. Like I said I was going to walk and I got outside. That felt really good and that feels good to acknowledge it. Like I did the thing I said I was going to do. When the laundry's looking at me from the dryer and I'm about to feel bad or guilty, like, oh, I didn't do it again. I'm not. I never said I was going to do that. Never said I was going to fold you. And I asked for help. I asked my husband to pick up dinner. I'm just practicing asking for help and accepting help. The last one's sleep. Parents need a plan for sleep, whether they're struggling with their mental health or not. If you're bringing home a newborn and you have a baby that's not sleeping, like you need help with sleep, you need a plan for sleep. That could be tag teaming the nights with your partner. That could be bringing in family friends or night nurses to help you. That could be working with someone on our team about sleep to get a good sleep plan because sleep is so connected to your mental health. There is research to show that if you can get sleep, consecutive nights of sleep, that you can have a serious improvement on your mental health symptoms. So when parents come to me and they're struggling with anxiety or depression, my biggest prescription is like, how are we going to get this person some sleep to help them start feeling better? And sometimes I'm layering sleep with therapy or telling them to talk to their PCP or provider for medication. There's other things that play into the mental health space, but at a basic level, all parents need sleep. And it's very hard to get when you have a newborn. And the solution isn't you'll never sleep again or good luck surviving those first 12 to 16 weeks home. It's like, how do we get creative in tag teaming, sharing the night, saying yes to the family member that will come over on Saturday and hold the baby so you can nap? Like, everyone needs sleep, and it is really important for your mental health. Now, get into some other tips that are helpful, especially for parents out there that are working. You can tell me in the chat or the Q&A if you're out there and you're working and you're balancing things and you're doing it all. I like to comment on this because a lot of parents that I work with are struggling because they're back to work 12 weeks postpartum and babies aren't usually sleeping through the night that early. Some are, some aren't. And now they're like back to work. They have a baby that's not sleeping. They have a baby that they're feeding overnight and they're trying to do like a daycare drop off. And like, it's a lot happening here, right? And it's a big identity shift. And maybe you're going back to the same job, but it feels new in many, many ways. You cannot be 100% to everyone all the time. It's a lot harder to recharge as a parent, especially when you're getting unplugged all the time. And the solution isn't to power through it and figure it out and like try to show up to everyone all the time. It's to figure out like what's calling to your attention and what needs you that day. So two things to think about. One, we have buckets, right? I need to take care of myself as a mom. I have 3 kids, so I'm taking care of my kids. I'm married. I have a husband, so I have my marriage and my relationship to think about. I have my family. I have my friends. I told you I own my own company. I have my business. I have my job. It's a lot of buckets. And all those buckets are like wanting me to fill them and they need my attention. And I can't do 100% to all of them. It's not mathematically possible. I worked with a therapist when I was postpartum. I told you I had postpartum anxiety. I worked with a wonderful therapist. And she talked to me she said, Emily, you're an iPhone. Parents are iPhones. When you go to bed at night, you plug your iPhone in. And when you wake up in the morning, if you slept through the night and you're your best self, you're 100% charged. And now you have your battery. And it's like, who needs my battery that day? Maybe my kid is sick that day and I need to stay home from work. So a lot of my battery is going to my kid that day. Not a lot's going to work. All right. But maybe the next week my kids are healthy and I'm really slaying it at work. I'm showing up on my best self. And at the end of the week, I'm like, ooh, I didn't really talk to my husband this week. We didn't really even hang out. Did I hang out with my kids enough? Right? Like you're moving your battery around. Now, a parent who has a newborn, you're getting unplugged at 1 a.m., at 4 a.m. to feed your baby, or maybe your toddler comes in the middle of the night because they have to pee, or your older kid comes in because she's itchy and she needs some Aquaphor put on her dry skin, and you're like, you've unplugged, you're back in again. You're waking up and your battery might be like 60%. You need to acknowledge that. My husband and I will say this sometimes, like, because this is something that really resonated with us. Because if your battery is low, maybe theirs is high. So I might look at my husband and say, like, I'm running on fumes. I am in the red. I'm less than 10%. And he may say to me, no problem. I feel good. Like I'm charged up. I'll handle bedtime. So communicate with each other. Let each other know how you're doing. Maybe that's telling your family members or your friends, like, I need extra help. Like, I'm not charged right now and I need to find ways to recharge. And that goes back to nourishment, eating, sleeping, getting the nap, going to bed early, having someone else do the night shift for you that night, asking your family and friends to help you, like back to those other things that we talked about, or going for the walk and listening to the podcast or going to the workout class. Like, what do you need to do to recharge? Okay. How can you help yourself if you're struggling with feelings of overwhelm, anxiety, depression, perinatal mood disorders, struggling in general, and you're like, I don't even know where to begin, right? Maybe you're hearing me right now on this webinar and you're thinking like, I hear you, Emily, and I'm not okay. Like, what do I need to do to help myself? I don't even know how to help myself. Step one is you just need to tell someone, anyone, family member, friend. Really, really great if you can just call your OB, your pediatrician, your primary care provider. It could be a NAPS nurse. I work with people all the time for feeding and sleep support, and all of a sudden I'm finding on that call or on an in-person visit, like, ooh, how are you feeling? Like, are you okay? How are you doing? I'm really not doing okay. Because now they've told me I can help them. I can say, great. The next step is I want you to call your OB. Let's call your whoever it may be, your pediatrician screening you with that iPad. They're going to say, notice you screened high, you're not doing well. Let me help you take that next step. It's really hard to take that next step and get help when you're not feeling okay. We want to get you connected with professional support. There's really great resources, and I'm going to provide them for you in a free download at the end. Postpartum Support International is one of them, PSI. They have free support groups of really like a ton of different categories, right? Your OB, your midwife, your primary care provider. These are the people that should be able to get you connected to the professional support that you need. Whether it's helping you make the appointment, making a referral for the person, giving you a list of the people that they like in their network. Peer support is huge. We know through evidence-based research that parents who have peer support when they're postpartum have really great outcomes when it comes to mood disorders and feeding success and overall just like feeling good as a parent. So PSI has free drop-in support groups. NAPS has a weekly free support group. Every week we have a weekly free support group that's virtual. We have in-person groups. We have paid for groups if you want to be in a new mom support group or a dad support group. Look in your community where you live because there's mothers associations, there's parents associations, there's parenting Facebook groups. You'll find things in your community of in-person support groups as well. We want to get back to outsourcing, especially when you're struggling with a mood disorder, especially when you're struggling, you need that extra help at this temporary time in your life. You need to unload all of the basic things of your home. Someone else needs to do the laundry, the dishes. Can we do the meal delivery service? Do you need to do Instacart? Can you pay someone to come and walk the dog? It's really hard to walk your dog when you're depressed. Like you need other people to help you. And that might be outsourcing to the family and friends, the people that we talked about. It might be that you need to pay for things right now to outsource. It could be a combination. Planning check-ins. If parents are pregnant, I have them learn the risk factors of mood disorders, and I have them tell their family and friends, hey, we're expecting a baby, as you know, in May, or later this summer. Here's a website link. Here's PSI's website. They have a great page of like all the mood disorders and what they are and why they happen and what the symptoms are. Just letting you know, if you notice I'm not okay during my pregnancy or when this baby's here, I want you to be able to recognize that so you can help me. And can you check on me? Can you ask a few family members or friends or people in your life, can you check on me when the baby's here? Especially, it's not just those first few weeks, it's that first year, right? And when you know that, especially when you're not doing well too, when you know that you're not feeling good, but you have people in your life that are going to check on you by a text or a phone call, or every Friday they're coming over to like see you and the baby. Maybe you make a calendar, right? My parents who are experiencing mood disorders and they're in active treatment, I'm like, let's make a calendar. Who's checking on you this week? Okay, Monday, you're going to go to the free breastfeeding support group. Tuesday, you have that new mom support group that's virtual. Wednesday, you have your pediatrician visit. Thursday, you have therapy. Friday, your friend's going to come over. Saturday, you can go on a walk. Like just putting stuff on the calendar so you know that people are checking on you is very, very helpful. I want to talk about finding a therapist because if you are struggling when you're pregnant or postpartum, most conditions, most perinatal mood disorders can be treated with outpatient therapy. It's really hard to find a therapist, especially in our healthcare system. So what are some tips? What are some things that I want you to know? First, decide if you want to go through your insurance or if you just want to pay out of pocket, right? Private pay therapists, con, they're more expensive. Pro, they usually don't have a wait list. If you want to go through your insurance, you want to call your insurance, you can ask for a list of providers that are in network. If you go on sites that are listed here on the bottom, zencare.co, Psychology Today, the PSI database, you can put in your zip code, you can put in your insurance, and you can look for providers that are in your network. So do you want to go through insurance? Do you want to do private pay? All right. If your insurance providers are not accepting patients, or they have long wait lists, or you cannot find someone, call your insurance back and tell them, I cannot find somebody that's in network. Will you reimburse me for an out of network provider? Because usually they will say yes. And that's where you're going to get your super bill and they're going to pay you back because they don't have an in network provider available. All right. Do you want to see your therapist virtually or in person? What like feels good for you? What would be a good vibe for you and what's convenient? Then we're looking at specialty, right? I want you all to find someone that you connect with and that you like and that you vibe with. And don't get too hung up on credentials. You're going to see LMHC, licensed mental health counselor, LICW, licensed, we have clinical social workers, there's psychologists, there's different credentials. Look for those who have a specialty or experience with postpartum mood disorders or a perinatal specialist. All right? Because specialty and experience is really important in addition to the connection that you feel with them. If you are someone listening and you're thinking that you're more of a helper or you're on the people list for a family, it's very helpful if you help someone that's struggling with the calls to find a therapist. It's really exhausting when you show up to your doctor, they give you a list of therapists, and you sit there and you call, no one answers or no one's taking patients, and you're depressed and you're tired and you hang up and you're done. Maybe you just say, like, let me sit with you. Let me help you make these calls. Let me help you find somebody. Let me call your OB back and tell them that this list isn't working. We need more options. So that leads me into, like, if you're listening to this workshop today and you're not a parent, maybe you're a parent and you have a family member about to have a baby, maybe you're a caregiver. How can you help other people? Know the symptoms. I already referenced PSI a few times. They have a great page. It's linked in the resource guide I'm going to give you that just says, what are mood disorders? What are the symptoms? So you can see, like, you can feel it. You can know when you're with someone, like, hey, how are you feeling? Like, it feels like you're not okay. How are you doing? Can I help you? Right? Share resources, share services. You're all going to get a free download from this that has support and resources. Share it. Share it with friends, share it with family, share it with your neighbor that you know is having a baby. If you know of any virtual, local, or community programs, like, keep sharing them. The more we can get out there for people, the better, because there's not enough. There's just not enough. We need to keep sharing what we have. Offer to help people find support. I already said this, like, can you make the calls for them? Can you reach out to their insurance, right? Can you help set up these appointments? Can you just do a basic search in the community for a group and then let them know, hey, I found this group that meets at the library once a week, right? Or I found this group online that meets free. Check it out. You be proactive and offer to check on them, right? They may not say to you, I'm not okay. Can you check on me? Just say, I'm available. I'd love to check on you once a week. I'm always free on Friday. Would you like me to always just stop by on Friday for half an hour and check on you? Or maybe you don't tell them the cadence of your check-in, but in your phone, you put a calendar reminder that once a week, you're just going to text them. How are you doing today? Not how's the baby? How's the baby sleeping? How's the baby eating? How are you? How are you feeling today? How are you doing? All right. Again, next level. Can I do anything for you? Next level. Can I bring you dinner? I sent you a gift card so you can get food this week, right? Be a helper. I always talk about at NAPS the difference between visitors and helpers. When you're postpartum, you're gonna have visitors, right? But we need to maybe, have visiting hours or set days. We want to have boundaries around it because you don't want your home to be a revolving door. And so helpers are the people that come in and they will unload your dishwasher. They'll cook you dinner. They'll fold the laundry. Or they'll just hold your baby so you can go upstairs and shower and take a nap. They jump in. They help. Either you feel comfortable asking them to help you, or you don't even have to ask. They just do the things. All right. Um, Versus visitors, my red flags for visitors when you're postpartum are like, you hear they're coming over, someone says they're stopping by, and you're like, like they're coming. I need to put a bra on. I need to clean up my living room. Do we have food? Do we have snacks? Like you feel like you have to tend to them when they're there. You're getting anxious that they're coming, or they're the people that come and overstay their welcome. Like they stay all day, they don't leave. There's no like, you don't know when they're showing up. Like visitors, helpers. Start to think about like who those people are and how you can set boundaries with visitors when you're postpartum, or maybe you're not in those early weeks. Maybe you're further out and you're having a hard time. Like those people need the clear limitations and boundaries, and we're letting the helpers in. We have a great podcast on visitors versus helpers. If you want to give that topic a listen to. So I referenced our free mental health download. If you scan this QR code, it takes you to a free download. And when you download it, it's a sheet that has how to help yourself, how to help others, the websites that I referenced, as well as emergency hotlines for if something's ever urgent or an emergency, and you need like a free hotline to call for parents. So I want to make sure everyone gets access to that. So I'm just going to hold on the screen for a second just to make sure you get it. I'm going to actually click it too, make sure it's still working for you guys. Let me move my camera out of the way so that you can actually scan the QR code. Let's make sure that's working. Great. Okay, I had to move my picture out of the way so you can actually scan it. So that's your free download. You can download it, you can screenshot it, you can text it or email it to parents. And with that, I always try to save at least 10 minutes, perfect, for questions from you. So we're going to come back out and we're going to open up the Q&A and answer some of your questions.
Thank you so much, Emily. This has been so insightful, and it's clear, with the engagement we've had in the chat, that our families and community here are really resonating with what you've been saying. So if you have any
There's so many people here, by the way.
yeah, if you have any questions,
Incredible.
just leave them in the Q&A box and we'll read them out. So a first one to ask here is, what are some early warning signs that I or my partner may be struggling with depression?
With depression. So your symptoms, so there's, and I will come out at the end and link that PSI site that I've referenced a few times. So we're looking for, when we think about depression as the specific mood disorder and the symptoms, it is often struggling to like just take care of yourself during the day, meeting your basic human needs, getting to your activities, sometimes not having an appetite, crying. Like everybody feels postpartum blues at first, like some highs and lows that first week home of like that hormone shift, but like feeling like you're crying a lot during the day, or you can't stop crying every day, not able to sleep because you're disconnected, not feeling connected to the baby, not feeling like connected to your family. That's sort of your depression symptoms. I'm going to slide into anxiety while we're on this one, because I do think people sometimes think it could be one or the other, but sometimes it can just feel like a mixture of both. Anxiety can present as feeling overwhelmed, as crying all day, not feeling hungry or having an appetite. Some patients report symptoms of irritability, like you're so irritable, you're angry, you're agitated. And then I mentioned earlier physical symptoms, having trouble taking deep breaths, like feeling like you have a tightness in your chest. Some patients just feel dizzy behind their eyes. That's an interesting one. There's like they feel a little off balance. And again, it can feel like a little bit of a mixture. I think I would say for you, if you're just not feeling like yourself, you're like, I feel tired, I just don't feel good, I don't have energy, or you're avoiding leaving the house, you're avoiding doing things, or you're not feeling connected to your partner or your baby, to just say to yourself, even if you're like, I'm not sure, is this too much worry? If you're ever, is it too much? I don't know. Ask somebody, tell somebody. Let it be their job to help you decide if what you're feeling is too much or not.
Thank you for that response. And here is, do you have any specific things for caregivers of toddlers? Babies can mostly stay still, but toddlers will climb on the fridge and it is exhausting.
Oh yeah, I have a toddler. She's 3. She's very opinionated. You all know the toddler game. We just need to give them exactly what they want so they leave us alone. No, I'm just kidding. Toddlers. Okay. Number one, we need to keep them safe, right? So like obviously we can't have them like climbing on the fridge, or my daughter was like climbing up in the window the other day. Kids are jumping on the bed or jumping on the couch. My first big tip for toddlers is, when can you change a no into a yes? Sometimes you can't because we have to keep them safe. Like, no, you can't run into the street without holding my hand, right? Like, so like my kids jumping on the couch, right? They have a ton of energy. No, you can't jump on the couch because I don't want you to fall off and get hurt. But yes, you can jump on the floor. Let's take all the pillows off the couch. You can jump on the floor. All right. So you can't always do that, but it's like, when can you turn a no into a yes? And then my other big thing for toddlers is options. Toddlers, they want independence. They want to do it their way. They want like, they're learning and they're growing and they're exploring, and they want like a little like control and independence, which is a good thing, right? Like we want that for our kids, and we need them to do the thing that we need them to do, right? So if I say to my 3-year-old, do you want to get dressed for school? It's almost time for school. Let's go get dressed. Do you want to get dressed? No. No, I don't want to get dressed. I've asked her a question that's getting me nowhere. So it's time to get dressed. Do you want to wear the pink shirt or the purple shirt? Because I need her to put the shirt on, right? But giving her options, she's like, oh, I get to pick. But it ends in the result I need it to end in, right? Even at bedtime, when that toddler doesn't want to go up to bed, it's time for bed. Do you want mommy to carry you up, or do you want to walk up the stairs? Like, you can do it in so many things. So when can you turn a no into a yes? When can you give them options? And knowing that sometimes you're not going to be one step ahead of them. They're going to have a tantrum. They're going to have a meltdown. And sometimes you do have to say no. And we just have to be there to support them and let them work through it. And then we're going to be moving on to the next thing after they work through that big emotion, because emotions are normal and we all have them, right? Even as adults, we do. We might not have a temper tantrum, but we might disengage and give someone the silent treatment, or we might just completely disconnect, right? We all are experiencing these emotions. We're just different based on our age level.
This,
Those are my toddler tips.
yeah, this next question ties in quite closely to that, which is, my son is almost 4 and gaining independence. How do I balance trusting him versus keeping him safe?
Yeah, I mean, we're always leaning into like age appropriate things. And so, and some of this is your instinct, like your parental instinct. So, would you let the 4-year-old go down the street to the park by themselves? No, probably not. But when you're in a park, I'm using a park as an example, right? Because I live in Charlestown, there's parks everywhere. When you're in a park with the 4-year-old and they want to like play by themselves, can you maybe not like hover around them? Like, can you be nearby where they know they can see you and can find you if they need you, but you're not like maybe following them around or watching them climb things? Like, you're giving them a little independence. So like, how can you find ways to give them the independence that make you feel comfortable and that keep them safe? You know, I think you're not always going to get it right as a parent, right? I said that at the beginning, like, oh, I feel like I made a huge mistake. Maybe I let my 3-year-old play alone in her room quietly, and I'm downstairs and I'm like, I'm letting her play independently. And I come up and she got into her sister's makeup and her face is painted blue and there's makeup all over the walls. And I'm like, well, that was stupid. I shouldn't have let her play upstairs by herself. Like, sometimes you're going to make a mistake, but you're doing your best to keep them safe in a way that makes you feel comfortable and letting them find their way. I guess I don't have a totally straightforward answer for that too, because everybody's risk tolerance out there is different. So it is about doing what you feel comfortable with too.
Thank you. And then this question here is, how can you take time for yourself each day without feeling guilty?
Guilt. We all feel guilt as parents. We all feel guilt. The therapist that I worked with, her name is Sarah Harmon. She's the founder of the School of Mom. I love her and I talk about her all the time. She comes in and does support groups for our Nurture by Naps members. And what she says to parents is, when you're feeling guilty, you need to ask yourself, are you doing something bad? Are you doing something inherently wrong? When I think about doing something that's really bad or inherently wrong, the top things that come to mind for me are stealing or murdering. Like, literally, like when you feel guilty, I need you to ask yourselves, am I doing something wrong? Am I doing something bad? And if the answer is no, I'm not, then guilt is not serving you a purpose in that moment, right? And when you can allow yourself to take care of yourself, and you all know this because you've done it. When you finally leave, get your nails done, when you stop at the gym on the way home from work and you feel bad or guilty that you missed 30 minutes of your kid's life because you're coming in after dinner and now it's bedtime, right? Number one, you're not doing anything bad or wrong. And number two, I guarantee you that when you fill your cup for 20 minutes or an hour, you're a better person. You're a better version of yourself. You are. We all know it because we've done it, right? And I want you to think about time as quantity over quality. A big example that resonates with this question and with parents that I come up with time and time again is that you worked all day and you're rushing home to get your baby or your kid from childcare, and you're like doing the bedtime, the sprint. You're like, I only see my baby, the minute we get in the door, we have dinner, bath, and bedtime, and that's it. The day's over. I missed them all day because I was working. And parents are like, I cannot possibly do something for myself on the way home, or when I get home, go back out again for half an hour because I feel guilty, like I'm missing that time. And are you your best version from 6 p.m. to 8 p.m. doing dinner, bath, and bedtime when you're like, am I allowed to swear on this? I forgot to ask. But like when you're like freaking spent, like when you're frazzled, like you're burnt out, versus if you stopped and hit the gym or you stopped and met the friend or whatever, you did the thing, you walk in, and maybe you only have 30 minutes now with your baby that given evening, but you're a better version of yourself. And the quality of what you're giving and the time that you're now going to have is probably going to feel better. I know it's going to feel better, right? Than when you're just like burning the candle at both ends. So ask yourself when you're feeling guilty if you're doing something bad or wrong. And if you're not, it's not serving you a purpose. You need to let it go and keep doing the thing that you're doing.
Thank you so much. And I'm afraid we've reached the end of our time today. So if we didn't get to your questions in the chat, write them down and you can always send them in an email to us after this is done and we can forward them along and help get those questions answered for you. Thank you to everyone for coming on today. And thank you, Emily, for speaking. It was wonderful. It's always great to have live conversations and questions. And I think that it was really insightful. I would like to remind everyone that a recording of this will be sent out shortly, as well as other helpful resources to find naps and to learn more. As you leave the webinar, there's going to be a quick survey popping up. So if you want to take a minute to write us and Emily some feedback, we would greatly appreciate it. Emily, thank you again, and we will
Thank
see
you.
everyone next month for our next Kidco Talk.
Thanks for having me. Thanks,
Thank
everyone.
you.
Bye.